We've become very interested in the kind of growth in these new technologies and what young people are learning through the growth, and particularly in terms of, I think probably most of you in here are familiar with the kind of movement towards preventative, personalised healthcare, and particularly in terms of the kind of neoliberal imperatives behind that to collect information, to monitor ourselves, and the rapid growth in recent years in that area. And relatedly, the kind of policies behind that. So we're trying to get a better sense of how those policies might be shaping what's happening across the various social sites that young people inhabit in their everyday lives, from kind of family cultures around, you know, the use of technologies within the family, through to what might be pushed and promoted through education policies. So really excited today to have people speaking here today from kind of education background. We'll say a little bit more about our approach to learning and pedagogy within the project later. But I think, you know, this push towards public health is incredibly timely. I think it raises a number of challenges about how we speak back to policy around this, and questions around inequality, which we'll also speak to today, because I think at the moment the notion of inequality around digital health is somewhat limited in terms of thinking about this as, you know, whether or not you have access to a mobile phone or the costs of internet. But of course, in thinking about affordances of technology, what people do with digital data, how they interpret that, cultural practices, norms, power relations around that, there's an incredibly rich set of complex questions around inequalities that we think aren't yet being addressed. So at the moment, we're interested in kind of capturing how young people are navigating that, how they're making sense of it, and what those challenges might be. And of course, a lot of that is kind of framed in terms of technology offering this solution, I think, to fix a lot of health problems, but also in terms of the kind of the crises around the NHS. And so the pushing out of those technologies, even in terms of recommended apps, the promotion of apps replacing pharmaceuticals. So the place of those technologies in terms of what they afford and where they're being used. Now, our perspective around that is to try and better understand how that fits within a model of kind of learning, and particularly kind of contemporary health promotion, and what is assumed about knowledge within those practices. So we're going to say a bit more about that today.
One of the things that I did a debate last night in London about fake news, which is a term that entered the Collins Dictionary yesterday, you might have heard. And we had one journalist there who wrote a book on bullshit, evidently. And he was talking about what lays behind the kind of clickbait era in which we live, and the style of journalism that operates now. And he talked about the fact that a lot of the fake news that's out there is underpinned by content that's driving people towards health-related and medical-related information. So it's the sort of things that might either relate to, you know, the sorts of foods you should or shouldn't eat, or how wine is beneficial to your health, those sorts of things, that a lot of the subject matter that underpins the ad revenue associated with that sort of content falls into our sort of terrain. At the same time, I think we started this initially mindful of the fact that it's incredibly fast-moving, and even being able to take a snapshot of understanding how, I think not just young people, but any people are brought into quite dramatically different habits of media consumption is really challenging. So the fact that now if you buy a new Note 8, a Samsung device, or many others, it comes preloaded with a news aggregator that will determine what sorts of news you access, and initially certainly not based on even your choices about what news providers you wish to use. And so you might be reading news from organisations you've never even heard of, but that becomes your kind of mainstay of information. So it felt like part of the context was to try to think about taking snapshots of different age groups and a sense of how rapidly this is changing. Is one of the reasons why we sort of framed this as a kind of methodological focus for today, to think about, well, how do you both develop research that has longevity but is capable methodologically of withstanding this kind of dramatic transfer of habits, behaviours and platforms that characterises this field. And that seems to be one of the things we kind of wrestle with, I think. And so within the aims, we have a few things we kind of want to look at broadly. Just to give you a bit of an overview of that is I guess ultimately trying to understand how young people access information, but also to understand the breadth of that. So the example I often use is Spotify and the selection of music based on your mood, and how this sort of data can be construed as health-related information for either the user or indeed the owner of the platform, which then may have an impact on how that data is both monetized or exploited by a range of organizations. And coming to terms with the breadth of that that range is really challenging too. And I remember when we were talking about this a couple of years ago, I guess, it was partly a thing that the NHS, with its recommended healthcare apps, just had nothing to do with what actually people will end up using or imbuing with health-related information. And you might have seen there's a kind of prototype app that essentially uses Instagram images to try to render a calorific estimation of your breakfast as you're taking a picture of it. And there again, we may have health-related information being used in that way. There's also an application that will, when you take a picture of your Coca-Cola can, will take that graphic and reveal to you how many calories are within that drink or how much sugar is within that drink. So it uses what's quite a standard sort of augmented reality application now to just change the image in a small way to show that information. So these are, again, feel like emerging practices at the same time as we're working within a kind of opt-out culture. So I was showing the team earlier this morning that my Google Fit tracked my cycling around London last night and does it automatically without me even sort of asking it to. And that also changes both, I think, that sense of what sorts of monitoring is taking place, but it also changes that sort of individual choice as well. So understanding how young people feel about those sorts of matters, because those have implications for things like healthcare and how we think of ideas like autonomy and consent, and they're not minor things for healthcare providers, certainly. So broadening this awareness of the field is a big part of it. Scoping out what's out there is part of also what we're doing here today to build a sense of what sort of work is going on, but even just to try to share impressions of methods and what things work and what don't. So if you wanted to employ WhatsApp as a methodology of working with young people, how does that actually work? And what are the challenges around it, either ethically or technically? We've gone through already initial discussions about what would be a good video ethnography application, and you know, these are quite fluid conversations, in part because startup platforms aren't terribly reliable, but equally things designed for academic research aren't amazing, so try to find bespoke solutions to make sure you can actually get to the lived experience of young people is one big challenge too. Whoops, too far. So we'll talk a bit more about the theoretical frameworks as we go forward now, but to put that into a bit of context then.
Yeah, so I think why young people, I guess, is one question that we're exploring, and I think there is an assumption, of course, about, we've titled this digital health generation, but I guess there should be a question mark at the end of that, because there are a lot of assumptions, of course, about young people's practices, their kind of familiarity with those technologies. But I think what was interesting for us is, the kind of producing and consuming, and that relationship, and trying to get past the kind of divide around young people as simply consuming digital health technologies and these being kind of ultimately surveillant and problematic. And I think the social life of data, where data goes, raises a number of questions for us today in terms of how do we track where data goes? So once it's out there, how as researchers do we sort of do justice to that in terms of understanding the impact of sharing information online? So from our perspective, one of the things that we thought was kind of beginning to emerge within critical digital health was the focus on learning and pedagogy in particular. And I think that's my background. Most of my work is around pedagogies and the body. And I think there's several things that really kind of jumped out for us in terms of why that might be an interesting kind of theoretical approach. Partly because we want to know how young people are producing digital health technologies and learning through each other, both learning but also undertaking what's been termed kind of lateral surveillance of each other. But also to trouble the way in which learning is kind of understood within dominant frameworks of health promotion. And I think what we typically see within the kind of neoliberal framing that Deborah was talking about was an assumption of knowledge transmission, that we put information out there through digital health technologies, and young people are positioned as learners who are rational subjects, and effectively, you know, there is the expectation that one should be acquiring information and doing something with that, and that will lead to change in health behaviours. And a lot of the kind of mobile health interventions that we see start from that premise of learning, that it's a deficit knowledge, and if we simply provide the tools through which people can better understand what they should be doing, and of course a lot of that is about risk management, that will necessarily lead to some kind of change in their health practices and their health behaviours. So of course all the kind of other theoretical work that we're drawing on will really trouble that in terms of the learning process. So the affordances of those technologies, the way in which the capacities of those technologies change as we move into different social interactions or across different social sites. So the way in which data might be interpreted, who do young people talk to about how to make sense of, for example, quantified data? What does it mean? What does this number mean? And how do I then change my health practices as a result? So kind of using the framework of public pedagogy to trouble that, and I think public pedagogy is a field which really recognises the need to bring in kind of educational theory and pedagogy into social sites beyond schools, and that actually for a lot of young people they don't learn about health necessarily through health education, but they're producing their own materials, and how do they reappropriate the tools that are already out there, the digital platforms that are already out there. So I think, you know, those are the sort of complexities that we want to look at. But I think as well, you know, they're incredibly targeted, this push around technology. So we've just seen, you know, these are the, well, it's pretty clear into the gender dynamics of this, and Jessica Ringrose here today talking later, I think would be, you know, really interested to hear her views on that in terms of the kind of gendered nature of some of these fitness products, how they're marketed, but as young as 4. So, you know, play-based watches which are actually about tracking physical activity. So these are being promoted right now on some of the children's TV channels, so you'll see adverts for these trackers, partly broken up with images of taking selfies and having fun, but predominantly about tracking movement. And of course apps for parents or other people who are responsible for young to navigate what's being called the kind of choice architecture. So as we move into the kind of mundane realities of making everyday choices, we can't trust our own, you know, ourself, our senses, our knowledge. We need technologies to help us make those choices. So things like the NHS Smart app, where you can scan the barcode of food products and know the kind of salt and sugar content and make choices around the architecture of different social sites. So I think lots of work in this area recently. So Williamson's work, Deborah, what saying about your work around schools, but really this push. So not just that young people are being encouraged to use it, but in some cases might not have a choice around that. So schools increasingly using some of these technologies to monitor the health practices of young people, and lots of good examples of where that can be used, and examples of more resistant practices, but of course there are some issues around the sort of corporatisation of...
Yeah, we can do. We're working with 4 schools in the local area for that. It's been challenging to get people not necessarily engaged, they're very enthusiastic about what we're doing, but actually getting things in place and in practice has been quite a methodological challenge that we're going to talk about later, and that is the reality of research, that we are trying to appeal to people's goodwill in taking part in our projects. The schools that we've got a range, a very diverse range, particularly for the area that we're in, of schools and of students, of abilities, and of levels of exercise as well, and what the schools offer in terms of PSHE. Because I think that's something that we really need to think about in terms of our schools, is they're not doing the same thing. PSHE which is physical, social and health education. It is not part of the curriculum. Different schools take it up in different ways. So we've got a school that are very, very hot on PSHE. They do PSHE in every tutorial, so that's in the form period in the morning, and then they have from ages 11 to up until their GCSEs, they do an hour of PSHE a week. Then we've got a school that does 2 hours of PSHE per term. So we're dealing with really, really different schools here and different ideas around PSHE, and I think that's something we really need to figure in when we're doing the base work of our surveys, our questionnaires, and it has to feed into what I like to think of as like the methodological landscape of what we're studying.
And already I think there's such a difference in the schools around the expectations and understandings of the presence of not just social media but a range of technologies in people's lives. And Victoria Pigeon, who's here today, I think, really interesting findings recently, haven't you, around young people's sort of feelings around the use of Fitbit in schools and how that might compare to, say, teachers' understandings of young people as being very invested and excited about technology. But some of those are replacing as well in terms of funding cuts within schools, those technologies replacing other services.
Yeah.
I have one example of it, a sort of mental health app being offered to children because they didn't have the money for a counsellor in school. So I think, in that kind of broader context around funding cuts, there's some interesting questions around inequalities there.
Definitely, and I think something that even just speaking with Emma and I have had initial meetings with all of the schools, and something that really came out for both of us, I think, is the different understandings that teachers have around social media and digital health. They didn't really understand what we were talking about in terms of digital health. It was always something we had to explain. And how they see parents' understanding of these things and the children's understanding. They're all very, very different. So they're all working at different levels with their base understandings of what we're doing as researchers and what they're doing in their day-to-day lives. And I think that's something that's really interesting that's initially come out.
And maybe just to say for everyone that we're looking at the 13 to 18 age group, so it's a secondary school context. I mention that only because my son, who's 7 now, I remember his first social media app was Mathletics, which was actually pushed by the school. Who's heard of Mathletics? You know what this is? So it's basically competitive mathematics, and you log into the system and you can play against people in your class, you can play against other people in your school or globally. And whilst it is there to sort of stimulate learning in maths, it's a massive disconnection for me in terms of how the school saw that as they didn't think of it as social media at all. So it's just a kind of learning tool. But at the same time, in the same year, Ethan's 4 years old, and they had a kind of sheet home to talk about internet safety. And I felt that was really early, but it just sort of made me think as you were speaking about the fact that some of these things, in terms of the school's, I guess, anxieties, are embedded from quite early on. And even now, at 7 years old, we had parents' evening, and the teachers sort of read out this bit about the internet. You can see they didn't own it. They didn't have a sense of it being something they really fully are comfortable with, but the teacher actually said, "We're told we have to say this."
Yeah.
And so massive. Even from that stage, you wonder what happens later on and how kids feel empowered about it.
Definitely, and I think it goes back to what you were saying earlier about how young people are potentially challenging, resisting, or taking on these the knowledge that they learn in these apps. They don't necessarily have guidance from anybody else. It's them and their peers working their way through, and I think that's very interesting in itself, and that's something that we are going to try and tap into in our qualitative element of the project.
So, what should we talk about next? Do you want to talk about this idea of entanglement, Emma?
Well, I think, the sort of theoretical approach is something we just wanted to flag up because I think this will be drawn out through the other presentations during the day, but it really goes back to Deborah. I'll say more about this in terms of the kind of sensory, but really I'm trying to understand the complexities of the entanglement I guess between kind of subjectivities, the body, and the kind of affordances of these technologies. And when we think about the kind of presence that they have in terms of everyday experiences, I mean, a lot of it has been written around the notion of like the mobile phone as a prosthetic and an extension of ourselves, but the capacity for kind of wearable technology now, the nudging, the kind of sensory experience of that, I think, is something that we're hoping to explore in our final phase of our approach, which we're hoping to do something a little bit different, to try and capture the relationality of using those technologies, and how the same technology might have different affordances as young people move across different social sites. So I think that would be really interesting today to hear, have some conversations around the methodological challenges of how we theorise that, but essentially trying to break down that several divides really between public and private, the body and technology, and for me it would be sort of pedagogue and learner as well, the notion of how does knowledge processes, how do those take place, how is learning embodied, particularly when we're talking about the capacities for wearing technologies, how we interact with those. So I think Nick Fox is here, so I'm really looking forward to hearing what Nick will be saying about how we do that research and the kind of micro-politics of that, but also what that means for us as researchers. And I think, relatedly, the kind of challenges of getting things through ethical clearance, that was a really interesting process for us in terms of, wanting to have the space to allow for that relationality to emerge, but then, having a very clear plan of what we wanted to do. So I think there are some challenges around, how we design for that research.
I'll tell you when the light bulb moment was when I went to a seminar at the University of Sydney where I was at the time, about 7 years ago. It was on e-health, and a health promotion guy got up and started getting very excited about the possibility of smartphones and how, as health promoting people, we can send people messages when we know they're near a park and send them a nudge saying, "You're near a park, how about you take a walk?" I just sat there as someone who's been critical of this sort of, paternalistic approach to changing people's health for a long time now, and just went, right, this is now where it's moving. And another person talked about, a medical doctor talked about, who deals with people with diabetes, talked about smart pill bottles and how the pill bottles could monitor whether a person had taken their medication. So it was all about patient compliance and monitoring. And of course now we have insertable pills, digital pills, where people swallow them and they send a signal to a patch on their arm, which then sends a signal to their healthcare provider. I mean, we're talking about massive internal now, from inside the body, surveillance of people's practices. And but that just raised a whole lot of kind of key issues for me, I guess, just that moment, which then started me on this trajectory. And
That lead deeper. What are they talking about then? Are they talking about how to design a better app, a better?
Yeah, they're talking about that. They also share a lot of sort of news reports about market research on why people may be using digital health or why not, and they have a bit of a debate about that.
Do they distinguish between like a really young person and just an adult, for example? Or is it sort of?
Sometimes they do, but I mean sometimes that's something I have been noticing as well. Is there has been a huge focus on the older age groups, of course, of the how to allow people to stay in their own homes with the use of smart chairs, smart floors, smart everything you can possibly think of, which involves them.
But no smart people.
Yes. And that's a real problem, I think, too, because we're talking about robotic care for older people. We're very lonely people. That's a huge problem with the loneliness, and yet we're now talking about sending robots into the home from people. In fact, they want people, obviously, to engage with. And I have a lot of concerns about that. But in terms of young people, it just struck me from my few years now of observing the digital health trajectory that young people, as we've been saying, that the digital native discourse assumes that they are all wanting to take up digital health technologies. But we don't know that because no one's really spent a lot of time talking to young people about what they want.
I mean, in terms of the sort of design of the project, so we've got kind of 3 phases that we're involved with in terms terms of data collection. So the first is a kind of really a survey to better understand what young people are using, the kind of key milestones in terms of when they use what. But one of the kind of key things in that, I think, is how they understand what's legitimate knowledge to them, what they do with that knowledge. So the relationship between the sort of data practices and the people around them, or the organisations that they see as their go-to, what they kind of official knowledge versus the knowledge that they might acquire through social media, YouTube channels, and so on. So getting just a better understanding. You don't really know what young people use or how they're using it. The second phase is really kind of understanding those social contexts in which those health practices take place. So trying to kind of understand the trajectory of how they move through different phases of digital health engagement, who's influential in that, and the kind of, I guess, the inequalities and opportunities that might present themselves through those practices and engagement. But the final phase, which we've not yet started, and I think it's going to be quite challenging, and we're really interested to hear views on this and get some feedback, but is I guess responding to this issue of real-time methods, and rather than asking people to retrospectively tell us about their digital engagement, is to somehow be present when they're doing that. And there are some questions about kind of walking through, asking people to walk through what they might do online. But what we thought, we were sort of piloting this in the project, was to use a digital application. We've tried various forms.
Yeah.
It looks like we might be using WhatsApp for this now. But to actually have a conversation with young people as they're engaging with some of those digital health technologies, to better understand where they are when they use them, why they might be using them. So quite literally, in terms of thinking about spatiality, whether they're with particular social groups that might be influential. It might be that we sort of understand, I think, the influence of family in that. So the Wellcome Trust, after our interview for the funding, were really interested in the kind of the family contexts in which data practices are being understood and shared, and the kind of class aspects of that as well. So we're going to be working with young people over a period of about 6 weeks, asking them to use some of these technologies, and then we'll be having some kind of live conversations with them as they're doing so, and undertaking kind of micro mapping of some of the social sites and key influences as they're engaging with those technologies. So, I'm sure probably you're thinking of the kind of ethical issues and challenges of that, but hopefully, we're kind of getting into the more micro aspects of engagement.
Definitely, I think there's a real sense of that being very hands-on and participatory from our end as well, not just setting them off and then looking at data. I think the way I probably naively see it, I think we all have like these beautiful rose-tinted views of how our research is going to go, is I'm going to be in Bath, I'm going to be able to engage with them, like have meet up for coffee with them, make it very informal, very personable, and really get a depth of understanding of what's going on for them when they're using these digital technologies. I totally appreciate that in reality, that might not be the case. I might be with some surly teenagers who are like, I just did it, I don't know. And you're like, oh, brilliant, that's nice, yes. But I don't know. We don't know the young people that we're going to be working with. But I think we do see it as very hands-on and participatory, and very fluid as well. I think that's something that we're really interested in across the 3 phases of data, is a sense of fluidity and connection between them. And the way in which we've worked around that is, something that I was thinking about while we've been talking is we're looking at the digital health generation. We're taking that as one term, but we need to understand the digital, we need to understand the health aspects and the generational aspects. And that's something that I'm really interested in working on this project, in getting a sense of what I keep calling sort of the landscape of the project and the methodological landscape of the project. So looking beyond the project walls if you will, seeing the project as almost like a case study and having internal and external elements to it. So I spend a lot of time looking at things that are not necessarily 100% project related. I'll be looking at hashtags on Instagram, for example, around Fitspo, you know, Legs Monday, whatever, I don't know. Looking at what popular apps are at the moment. The top 100 apps is something I like to keep on top of and see which are health related and what kind of health related themes they speak to. Because there's so many different kinds. Something else that I do is keep an eye on policy and what's going on there. I'm very keen as well on looking at BBC Three and the kinds of things they're generating around digital tech and people's engagement with it. And getting a sense of that, BBC very recently did a survey with Ipsos Mori and looked at how young people perceive themselves and how older people perceive young people. And there was a massive, massive disparity between that. For me, that's what I would call external data for this project. It helps me get a better understanding of young people and the digital. The health element may not be there, but it's still integral for my understanding when I'm going to be speaking with young people and understanding the landscape that we're actually studying. Because these things that we're looking at, they are so entangled, interwoven with everyday life, and then so many areas of life as well, that to get an understanding of the digital health generation, our understanding needs to be much broader than just the very subject that we're looking at.